had poliomyelitis.
I don't believe that when parents have options that it causes big problems with disease outbreak.
Are we going to weigh the benefits for one against the benefits for many?
Pertussis, whooping cough, and measles. You know, those things are not benign. We've really been victims of our own success. People have forgotten what those diseases do to you.
Hello and welcome to Southern Remedy. I'm Dr. Rick DeShazo.
And I'm Melissa Faith Payne.
Public health officials across the United States are reporting numerous outbreaks of vaccine-preventable diseases. We'll explore the reasons why and the current attitudes about vaccines.
But first, we'll meet someone who lived through the disease outbreak of the 1950s that shook our nation.
I'm Walter Cronkite. This has been called a century of war. Today, we present the story of a war that was won by all mankind against a cruel and crippling enemy whose favorite victim was children. The story, Victory Over Polio.
Well, March of Dimes was started in 1938 by a sitting president, the only nonprofit to ever be started by a sitting president, which was FDR. He had polio himself, and we began as the National Foundation for Infantile Paralysis. And we started to find a solution and a cure for polio.
It's all because of a thing called polio. Now, I know you've heard of polio because you've been given your polio shots.
But I was just wondering whether or not the discovery of the Salk vaccine made you forget about the kids who are still crippled.
I'm asking for children who are casualties on the battlefields of infantile paralysis. For them, vaccine came too late.
But these boys and girls didn't get their polio shots in time.
As a result of polio, the vaccine can't help them now.
I'm Brenda Barrett, and I am a polio survivor. I was 6 years old. It was 1952, and the raging epidemic of polio was inhibiting everything and everyone. I was sent to Vicksburg, Mississippi, because Mercy Hospital at that time was the polio clinic. And the experience of even considering to go there just had my family upset and wringing their hands. They just couldn't handle it. Right across the room from me, directly across, were instruments called the iron lung. And a child that was in there was having difficulty breathing. And the iron lung did for them what respirators do today. I had no external appearances of damage. Others that were discharged about the same time as I was went out with leg braces and crutches or in wheelchairs. It wasn't until I was 30 or 35 years older that things became apparent that there was damage done. Fatigue has been my biggest enemy. And when I became power chair bound, that was a terrific blow.
The Salk vaccine had been found safe and effective against all known types of paralytic polio.
In 1994, March of Dimes did publish that polio had been eradicated from the U.S. That is true as of this moment. It is still an active virus that is seen in many countries around the world. because it is still out there, and in many countries are not eradicated yet.
Some vaccines are required, some are recommended. State Health Officer Dr. Mary Currier joins Dr. Rick to discuss Mississippi's immunization laws.
So we're talking about immunizations and trying to figure out who calls the shots on what. Who determines what immunizations people, not just children, in Mississippi should get, and when does that mandate kick in?
Mm-hmm. So there's a school immunization law. Every state has a school immunization law, and the health department decides what vaccines are required for school entry. In general, recommendations for people to be vaccinated, adults, children, infants, adolescents, come from CDC and from other places, but we follow and make the same recommendations as the Immunization Practice Advisory Committee out of CDC.
Okay, so the CDC is this federal government agency,
right?
Centers for Disease Control in Atlanta. And so you get some kind of information from them every year about what they recommend for immunizations. And the state gives you the authority through this law to implement what part of that you think is appropriate for Mississippi. Is that correct?
Correct. There's a subset of vaccines among the recommended vaccines that are actually required for school entry. That's right.
Okay, so when does that law and authority kick in? Does it kick in as infants, as preschoolers, or kindergarten? Where does it kick in?
As long as the child's had the appropriate vaccines by the time they reach kindergarten entry, they could get them all in the year prior to starting school. There's no law that says they have to be vaccinated as an infant. Now, the recommendations for the safety of the child to prevent disease are that they start in infancy.
So how does the daycare piece fit in there?
We also have requirements for daycare center entry that are very much like the requirements for school entry, but they basically say a child must be appropriately vaccinated for their age while they're in a daycare center. And that's not just to protect the child, but to protect the other kids in the daycare center. You know, there are diseases that still occur that those children can pass along to other kids in the daycare center who might not be old enough to be vaccinated.
Right. So if parents have the discretion to immunize or not to immunize during the infancy period, why do they not have that same discretion during the school period?
The vaccines that we require largely are for things that you can catch in the school setting. So, for example, DTaP, which is diphtheria, tetanus, and pertussis, comes as a package deal, and it includes pertussis, which is one of the things that's still around that we still have in the state.
That's whooping cough, right?
It's whooping cough, yeah, sorry. Whooping cough is one of the things that's still around that can still kill children. We still see a little bit of it in the state. We had about 60 cases in 2013. So we want every child in the school protected. If we vaccinate all the kids who can be vaccinated, who don't have a medical reason for not being vaccinated, then we can protect the ones who can't be vaccinated or who didn't respond to the vaccine. Vaccines aren't perfect, so not everybody develops immunity when they're vaccinated. Most people do. But if you vaccinate as many people as possible in the school setting, then you'll prevent transmission within the school setting. And the same thing is true really if we vaccinate our kids, then we're protecting their grandparents, we're protecting the infants in homes who are too young to be vaccinated. We're preventing transmission by getting that child vaccinated. So it's not just about that child, it protects that child, but it's about the people around that child and protecting them as well.
If parents choose or want not to immunize their child for whatever reason in the public school system, they have to request that they not be immunized. There's an approval system. What is the opt-out, the present opt-out option for parents?
The Mississippi law allows medical exemptions for vaccinations, and the way to get a medical exemption is to go to your private provider who can say, yes, you don't need to get this vaccine for whatever reason, and they send a letter or some sort of written transmission to the local health officer who can approve that. We don't have religious exemptions in this state. 48 states have religious exemptions, and we don't, because they were found unconstitutional by our state Supreme Court. We used to, long ago, have religious exemptions. We don't anymore because of the Supreme Court ruling. 18 states have philosophical exemptions, so if a parent says, I don't want my child vaccinated because I don't think vaccines are good, then they can go through some sort of process and get their child exempted just because they don't believe in vaccines. 18 states have that. We don't have that. We would really like to not have that. There are places in this country where it's easier to get an exemption than it is to get vaccinated. And in those places, we're seeing a resurgence of pertussis, whooping cough, and measles. You know, those things are not benign. We've really been victims of our own success. People have forgotten what those diseases do to you. Whooping cough can kill an infant, and it can leave them brain damaged. It's a really deadly disease in a small child, and those infants are too young to be vaccinated. So we need to vaccinate people around them to protect the infants.
Because so many people are being immunized, it creates kind of a brick wall that is protecting the whole community from whether it's polio or measles or mumps or smallpox or things like that, or pertussis, whooping cough.
It's difficult to convey because different parents have different ideas, and you have to take each situation on its own merit.
I don't have a lot in terms of parents and grandparents, the concern about the immunizations as immunizations. The concern that I usually have is for those children if they're behind and we wind up giving them 5 to 7 injections at a time. So the concern is usually the number of times that child has to be stuck.
I have an 11-year-old son, he's my youngest, who had a vaccine reaction. And it was very, very difficult for me. He was 5 years old at the time, he's 11 now. And it took me over 5 years and 3 different doctor's letters to finally get an exemption for him. My name is Mary Jo Perry, and currently the co-director of Mississippi Parents for Vaccine Rights. And we're a group of parents who are quickly growing, who want to have the same laws in Mississippi that 48 other states have. Mississippi is one of only 2 states in the entire country that only has medical exemptions, and my personal experience, and also the experience of lots of other parents, is that those medical exemptions are very difficult to get, and you almost have to have an injured child before you can get one.
I went through the experience myself of giving birth to 2 premature babies. They were my first, if you will. My first was 2, and they were born 8 weeks prematurely. So they were the exact population of children that I'm talking about when I say at-risk population. I was anxious to vaccinate my children. I kept them out of a lot of social situations until they were vaccinated, for fear that they would, in their very compromised state, pick up things that would not be beneficial to them.
I think the vaccines are beneficial, and the fact that if you have a licensed daycare or if you're about to enter school, you must have all your immunizations. That is good, but the part that I don't like is the fact that, unfortunately, some patients may show up at that time when they decide they want to put the child in daycare, and that child may be 12 months of age. So that means that we're starting the series that we should have finished.
I was a little bit skeptical about whether or not I should. I was nervous about vaccinating my 2 little ones, and when I went to a GI doctor when my middle one was 2 years old, he took our medical history, and he said, well, you probably need to consider delaying. There was a time when we all just trusted the medical establishment, and you know, the government telling us that we needed to vaccinate our children for certain diseases or they were just, they were going to get sick and die. But it has gotten to the point where our schedule is so enormous and so rapid fire, and they're piggybacked on top of each other, like we were talking about the 8 vaccines at 8 weeks old, is just, that's tremendous to me.
March of Dimes follows nationally what the CDC recommends. So what the Center for Disease Control, who of course has lots of medical support behind the decisions that they make, what their scheduling is for children's vaccination is the same scheduling that March of Dimes supports. Those aren't just made up randomly with, well, we think this child is probably going to be able to handle 3 or 4 shots more by the time they're this many months old. That's not the process that they go through to determine when a child needs to be vaccinated.
I don't believe that when parents have options that it causes big problems with disease outbreak. The majority of outbreaks are occurring in vaccinated individuals. We can look at our bordering states where parents have options and either religious or philosophical exemptions, and they're not having major issues.
The exception rules, when you think about, well, I'm going to vaccinate my child, but I'd rather do it when they're 10 instead of when they're 5. Well, you're opening that child up for those 10 years to being susceptible to all these things that are still present in the world.
John and Jacob are both in school and they're both fully immunized except for the 7th grade pertussis booster. We have a medical exemption. So my kids are really, they're like scot-free, we're done. But I stay in this fight because I know what it did to me and what it was like. I felt like I was being terrorized to know that I watched my son have a seizure following his vaccines.
But you also have to remember in those eras when a lot of the research that's available to us today that keeps us healthy, it wasn't available years ago. Those babies that were born too early died years ago. Those children that got polio suffered the consequences years ago. So we've grown up in a privileged medical world too, in that we have benefited from 75 years of research, and every one of us have been touched because we don't have polio.
My message to parents is, get your children immunized. Don't let fear based on, in some cases, rumors, other cases, misunderstood science. Don't let that jeopardize your child and your child's health.
Barbara Love Fisher, co-founder and president of the National Vaccine Information Center in D.C., has worked the last 3 decades leading campaigns to institute vaccine safety reforms and informed consent protections in the public health system. Thank you so much for joining us, Ms. Fisher. Why do you think there's a growing number of pockets of unvaccinated individuals?
Well, what we know is that there are individuals, as I said, who cannot get vaccinated because they have, for example, had a vaccine reaction to a previous vaccination. They may be allergic to a component of a vaccine. And so there are some people who can't get vaccinated. There are also some people who have personal conscientious belief reasons for not using one or more vaccines. And we support the right of all Americans to be able to have flexible medical conscientious belief exemptions in vaccine laws. Because we're not all the same, we don't all respond the same way to vaccines or infectious diseases. Vaccines do not always protect you. You can be fully vaccinated, still be infected, still transmit infection, sometimes without any symptoms. So this is an area, the issue of vaccination and health is an area where there are a lot of gaps in the science. We need to know more, we need to do better studies, But we also need to be able to have the right to exercise informed consent to vaccine risk-taking.
You mentioned gaps. Specifically, what do you speak on when you're talking about those gaps?
Well, between 1991 and 2013, the Institute of Medicine published a series of reports about the medical literature and evidence in the medical literature that vaccines can cause different kinds of brain and immune system problems. And one of the most shocking conclusions of almost every one of those reports is that there are huge gaps in vaccine science. In other words, we don't really understand the reasons why vaccines cause injury and death for some people. The Institute of Medicine acknowledged that there's individual susceptibility for biological, genetic, and environmental reasons for why some people are more susceptible to suffering vaccine harm. But the problem is, all of those reasons have not been identified by science. So the real take-home message is we have to do better science and more science.
The CDC, are they not stepping in? Are these gaps that they're ignoring? You know, what's being done about this?
We would like a study comparing the children who get all the federally recommended vaccines on schedule with children who get some of the vaccines and children who remain unvaccinated. There are some children who are unvaccinated in this country. We can do that kind of study. We can compare the outcomes of vaccinated and unvaccinated children and answer some of these outstanding questions about whether or not children who are highly vaccinated are suffering more chronic health problems during childhood and later in life.
What about those states like Mississippi where the only way that you can actually opt out of a vaccination is through some sort of medical exemption? What do you say to people who live in those states?
The medical exemptions have been so narrowed by the government that almost nothing qualifies today as a reason to not vaccinate or to withhold vaccine or delay vaccine. So you have a difficult situation if you have parents who, for example, their children have had a health decline after previous vaccinations, and they can't find a doctor to write a medical exemption. They're put in a very difficult position because they don't have a religious or a conscientious belief exemption to exercise. We believe every state should have flexible medical and conscientious belief exemptions in the laws, so parents aren't put into this really untenable position of having to either choose between either obeying the law or putting their child's health at risk.
Thank you so much for joining us.
Thank you.
It's really interesting when you think about this in terms of the historical context. People have always been worried about vaccinations ever since the late 1700s when the science of vaccines really started coming about. People have been very, very concerned. People have said that people should not be vaccinated on terms of religious grounds. And then today we even have countries like Nigeria, Afghanistan, and Pakistan, where again people are saying, you know, on religious grounds they shouldn't have vaccines, like they shouldn't have the polio vaccine. So it's really interesting when you take that long view of what's going on, because people have constantly been worried about this issue about vaccines. Are they safe? Are they effective? What are they going to do to my children long term? So then nowadays also I think we're up against the issue of the internet. So because there's so much information out there, it's so accessible, so people are bombarded with a whole lot of different kind of venues of information, and they don't know what's accurate.
The purpose of Mississippi Parents for Vaccine Rights is to bring parents together in Mississippi who are like-minded about parents having the same rights that parents have in other 48 states, which is that we would have a say in vaccinations.
I'm Sam C. Mims V, a member of the Mississippi Legislature. I represent District 97, which is parts of Pike, Adams, Amite, and Franklin counties, and I'm chairman of the Public Health Committee.
We believe that the law needs to be changed so that parents have a say, but currently we don't. We only have a medical exemption that has to be granted by the State Department of Health.
We lead the nation in many statistics that are not good, whether it's unhealthy eating, obesity, diabetes, and so we really have to have more individual responsibility as we go forward in our citizens.
Lately, it seems like if anybody questions our vaccine schedule, they're automatically labeled anti-vaccine.
I will say that there are groups out there that do believe very strongly that we ought to have a philosophical waiver. And I understand their thoughts and their beliefs, and I've met with them. And I've also heard from lots of other groups that believe what we have today is working. They may not be the capital, but they call me and they share with me their thoughts that the way that we're handling our vaccines right now is working. These are mom and dads, these are teachers, these are public educators, these are folks that send their children to child care facilities. They say it's working.
Is questioning and wanting to do it a little differently anti-vaccine? I don't think it is. I don't think it's anti-vaccine. I think it's smart. We're thinking for ourselves, and we're not just doing what the government tells us to do.
Again, I understand the other side. I understand their thoughts and their beliefs, and I can assure you as a father of 3 children, children's safety is the most important thing to me because I have 3 children. And so I would never, ever do something to somebody else's child that I think is not right because I'm a father first. I'm a Christian first and a husband and father.
For the past 2 years, we have had really strong support in the House, and we've asked Sam Mims why he won't let the bill vote, and his answer to us was, Mississippi's not ready for this. But we feel like Mississippi is just as ready as any other state in the country.
So I go through and look at every piece of legislation that's introduced. I study it. I seek advice from outside groups. I also seek advice from people that serve in this body and also the folks that serve on the committee. And at the end of the day, we have to make the best decision that we think is best.
A lot of parents feel philosophically that, you know, I'm my child's parent. I have the best decisions for my child. I should be able to make those decisions, whether I think that they should be vaccinated or not. While in theory, yeah, I agree, as a parent, we all feel responsible for our children. There are some things that are known risk to our children that we all are under law and requirement to do to keep our child safe. Safety seatbelts are an example of that.
When I look at the individual rights versus what's good and right for the society, you have to weigh the balance in that, are we going to weigh the benefits for one against the benefits for many? So it's just as a scenario in terms of free speech. We all have free speech, but if you're in a crowded movie theater or if you're in a crowded banquet room, you can't holler fire. You holler fire and you may lead to the death and injury to a number of people. So that's how I view immunizations, in that we need to balance the public good, what's good for the general population, specifically the children, and also what's good for the individual.
It's your child, and you have the right to make decisions about your child. When it comes to keeping that child safe, there are certain places in our lives where others step in to make sure that all children are safe. Vaccines, I think we need to think about in the same way, because if you choose to not vaccinate your child for whatever reasons you may have, you open your child up to a number of risks that you probably never intended to do. Your intent was to keep them safe, but in reality, you put them in harm's way even more.
Thanks for joining us. Please visit our website for extended interviews and more information.
For all of us at Southern Remedy, good night.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center.